what I thought I'd do, we have roughly an hour to visit, and I have a little different take on what causes hardening of the arteries, or a more common term is atherosclerosis. And it can actually be looked at in a very simple way. And hopefully, after this brief talk, it'll make sense. And then I'd like to have maybe a good 20 or 30 minutes for questions. So there's two words that I want you to think about with atherosclerosis. One is trauma, but I call it barotrauma. And the other thing that is absolutely essential, you have to have both of these. You have to have bugs. And they can't be just any bugs, they have to be happy. And I'll explain that. It'll make sense, I promise. Okay, the source of all this trauma happens to be one of my favorite organs. It's your heart. It's ridiculously violent, if you think about it. If you've ever had your heart literally try to beat out of your chest, you know what I'm talking about. Well, it pumps blood out, and it goes around, it comes down. Here's your abdominal aorta, and then it divides into iliac arteries that go to your legs. And up here, you know, there's the big arteries that go up to your brain. And the first two arteries off the aorta are your right and your left coronaries. Well, from before the day you're born, I guess as soon as your heart starts beating in utero, 24/7, every single day of your life, this guy squeezes down like crazy. Well, that pumping literally beats these big arteries with a lot of force. Now, as you get further out into the arterial tree, you don't see blockages of arteries. You don't get them in your fingers. You don't get them in your feet. These big main arteries take the brunt of that abuse. And this trauma occurs over time. So the hardening of the arteries significantly increases with age. All of us in this room, except maybe my son, have plaque all over the place if you really look for it. You can't not have it. If you're alive and your heart's beating and you live long enough, you're going to have areas that get calloused or thickened, and there's no way around that part of it. Now, this trauma part is worse if you have really true high blood pressure, because these are they get beat up harder. It's also quite a bit worse, and this is important, it's something you could do something about. These arteries have to be very, very flexible to put up with this pounding. If they're in any way not so flexible, then it's much more trauma. And my favorite analogy is a spoon. You got a nice heavy one is best. If this is the inside of your artery, and every time you tap it, that's a heartbeat. Well, hypertension would be hitting it harder, which you're going to get a red sore hand and it'll probably calcify. Well, being low in fish oil makes this more rigid. So if you held your hand tight and you hit it with a spoon, it hurts more. So the omega-3, which is fish oil, it's essential for this distensability. And unfortunately, we're not that close to an ocean, so it's not that easy to get a lot of fresh fish. But if you don't eat fish in any quantity, then at least some sort of omega-3 supplement's a good idea. It does many other things, but the flexibility of your arteries is a big one. So it decreases this whole trauma thing. Now, another important thing, we have other blood vessels. We have all these veins, And we also have what we call pulmonary arteries, the arteries that go to your lungs. They don't get this atherosclerosis either because it's a low pressure system. If you take a vein out of your leg, or a surgeon does, and he puts it as a graft, well, he put it in a high pressure system, it gets the same atherosclerosis as an artery does. So this is essential. You have to have that. And I want to give you two examples that are fascinating to me. I was just a young, relatively stupid cardiologist at the health center. And I saw a woman, she was in her 20s, and she had what we call classic claudication. She was trying to keep up with the kids. She could walk 20 feet and she'd have to stop because her calves would just kill her. So she comes in, and sure enough, she has, from her femoral arteries on down, has very, very weak pulses. When I listened over her abdominal aorta, she had what we call a bruit, a swishing sound. And so I did an angiogram on her, and she had like a 90% narrowing right here. Tight. Her arteries everywhere else were normal, completely normal. It didn't make any sense at all. It was like, how did that happen? And so I went back later and I talked to her and I said, did anything odd happen to you as a child? And she said when she was a little girl, she was visiting her grandmother, and she was crawling up on a cast iron stove. And the stove fell over on her. And those stoves, they sort of have a little lip, that sticks out. So she got squashed right there. And the adults in the room heard the screaming and hollering, and so they picked the stove off of her. It wasn't hot, it was a crush injury. Well, she got over it and went through life, and then over many years developed this. And then the second example that I saw was, and there's cases, I haven't seen this particular thing in the literature, but there's cases of, if you have to think old model cars, way before airbags. On the front of your heart, there's an artery that's right smack dab behind your sternum. And back in the days when steering wheels were really, really, really strong, if you got in a wreck and hit the steering wheel did not break, but your breastbone would. And if you broke your sternum, smack over the LAD, the same thing will happen. So you can be an 18-year-old kid, you get in a wreck, you break that bone and it hurts like crazy and you get over it. And then 5 or 6 or 7 years later, you come in with a 90% narrowing it. Those are just examples of, they're unusual examples, but it's again trauma. If you, when these arteries, like if they're not traumatized, let's say, whatever. Let's say here's your artery, and here's a plaque. Here's this guy. If you look at this under a microscope, the smooth parts of arteries, they're completely sterile. There's no bugs in them. They can't stick there. And the bugs I'm talking about, for the most part, we live with them. They're in our mouths or gums. And you can bite a Dorito chip crooked, and I guarantee you're going to have bacteria floating around for a while. If they can't stick on anything, they don't survive, and your immune system kills them. Well, if there's anything irregular or roughened or calcified or what have you, they stick there just fine, and they do what we call, they colonize it. And it's just like our skin. Our skin is colonized with bacteria all the time. It's not doing us any harm unless this happens. So biochemists usually call this a biofilm. The bacteria live there, they hide, but they don't do much else. They don't divide rapidly or cause too much trouble. Well, the way you make this side of the equation bad is anything that suppresses your immune system. And most of these things we're familiar with. Maybe the most common, really, would be stress. And humans are perfectly adapted to handle intermittent stress. But if it's stress that's day in and day out, either some real tragic family kind of situation or job, then you have a chronically high cortisol level. Well, cortisol is just like the prednisone that is used to suppress your immune system if you have a variety of, let's say, autoimmune diseases. Well, if you do that, the bugs get happy. And when they get happy, they divide. And this little bump that's just fibrous and maybe some calcium in it becomes like a boil, becomes like a pustule. And that's bad because then they can rupture and bad things happen. If you're deficient in a few critical things, vitamin C for sure, it's essential for our immune system. It's also essential for the integrity of arteries. We've only known this maybe for the last 7 or 8 years, but vitamin D3 is essential for our immune function. If you get enough sun, you make it great, but in the winter months, it's not a bad idea to either take D3 or go to a tanning booth. And then, just my favorite molecule is Q. Q is the cofactor for energy production in all cells, every one of them. You couldn't live a second without it. We make it very well when we're young. It starts going down really, certainly by age 30. There's some in our foods, but it's mostly in organ meats. Hearts have the most. Chicken hearts are really good because birds have 3 times the concentration of Q as they have cow. Because they're hyper, they fly, so they have a lot of Q. But so it goes down, and if you don't eat much in the way of organ meats, as your Q level falls, a lot of things don't work well, including your immune system. Those cells are super active. I mean, they have to have a lot of energy if they move around and eat things. So these are just real basic, simple things, but what I think is a perfect example of making bugs happy, and it's the Achilles heel of heart transplant. You can take a weak heart and take it out and stick in a 20-year-old's heart. And those arteries are beautiful. They're smooth, they look great. And then you suppress the immune system so you don't reject the heart muscle. And within a year, it is not uncommon for these coronaries to all be blocked up because of this. When you suppress your immune system that powerfully, you get this fulminant atherosclerotic process. And it's the #1 problem in heart transplantation. And there's really no way around it. If you didn't suppress your immune system, you'd reject your heart, and your body would actually kill the new heart. So that, they have to do it. But it's an example of how important your immune system is in this whole process. So the plus sign is important. If you make bugs happy and you have no trauma, this process doesn't occur in these low pressure vessels ever. So go back to your heart transplant patient and you got them on these strong immunosuppressant drugs. The atherosclerosis will only occur where it normally occurs, in high pressure arteries. It won't happen elsewhere. So you have to have both of these things. Now, I'm not going to talk too much longer, but this is not unlike at all a boil or a pimple. In fact, back when, it's way back before the cholesterol hysteria came around, many brilliant physicians felt that this was exactly that. This was a process where you have microorganisms and then you have your body's attempt to defeat them, and so you have a bunch of white blood cells in here. And believe it or not, cholesterol is one of your first lines of defense. Cholesterol is wonderful at binding bacterial toxins. So, and it's one of the reasons, and this has been known for a very long time, people with just congenitally low cholesterol, they get way more infections and they get more cancer. And then the flip side of that, people who are lucky enough to have a cholesterol of 300 or 400, they virtually never get sick. They're the ones who are still, playing chess in their 90s and that kind of thing. It's, so, cholesterol has been unfairly vilified for so long. It's, and part of that is, unfortunately, it turned into a big business. The last I read was worldwide sales of just statin drugs is pretty much close to $1 trillion a year. That's never happened in any category of drug, nothing close to that. So that kind of money, unfortunately, influences physician education, continuing education. It influences practice guidelines. So right now we're kind of in a mess with this. That we're on the wrong track, and we're forgetting some of the things that really do count. I think that's pretty much my part. And then I'll be happy to take questions on it. It could be on any topic. Sure.
You already have the whole process going where you're building a plaque. Mm-hmm. Then will these things clear it out?
That's a good question. We don't know for sure, but I can tell you this. If you look at carotid arteries, because they're easy to image, and you can very accurately measure, we have seen cases where, let's say this is 30% or something. We've seen it where you check it in 6 months and it's worse. And then in another 6 months, it's 90% or something like that. We've seen the opposite happen. We've seen it get better every 6 months. So it absolutely can happen. Well, exactly why, because usually you're doing more than one thing at a time. It's hard to know. I can tell you a very exciting thought, though. It has to do with this product, Restore, that I've been using in my practice for a little over a year. It's, for those of you who may not know what it is, it's a water extract of 40 million year old soil that they get in Nevada. It has a number of compounds in it that are very scarce in modern farmland. It's sterile. You take a spoonful a day, and it does a lot of really interesting things. It makes your entire microbiome healthy, like really healthy. So a lot of GI issues go away within a month. But then other things happen that are fascinating to me. One is there's a relationship between your gut and your brain, and so people tend to sleep better, they handle stress better. There's a relationship between your immune system, and I've seen three people now who've been on Restore for almost a year, where their toe fungus is gone. Now, the reason that's super important is, if you think about that, that means this product is actually influencing the balance of power. Our skin is covered with bacteria, and I guess if they're super healthy, they can compete with or destroy the fungus that's in your toenail. And that seems to be what's happening. As I said, these plaques have bacteria in them, not really the friendly kind. And we have about maybe 7 or 8 patients where we've measured this in their carotids and put them on Restore, and we're going to remeasure it in 6 months. I mean, what if by altering the balance of these microbes in the plaque, you decrease this? I don't know if it'll happen or not. I haven't, but I'll know before the end of the year for sure.
I have one other question. Is there more than one omega, like the omega-3 and the omega-6 and the ratio, and we all studied that, but I understood that there is a third omega, an omega-9?
Oh yeah, there's a lot. But there's only 2.
It would like clear the arteries. Am I misunderstanding that?
Yeah.
Okay.
Yeah.
Thank you.
Yeah, there are other, it's one of those Greek things, you know, you have a fat, let's say it has 17 or 20 carbons, different lengths. One end has a carboxyl group, and then the tail end they call the omega end, the end like the alpha omega. And then if the double bond's on the third carbon, then they call those omega-3, the whole family. And if it's on the 6, it's called omega-6. But yeah, they can be other places, 9. 3 and 6 are the only fats we can't make. They're both essential to humans. It just happens to be that the omega-6 we have a huge amount of. So it's a little off balance. Every seed oil you can imagine has omega-6 in it. The fat from factory-raised pork and chicken is 100% omega-6. So that's why, if you have a preponderance of one and not so much omega-3, it's not good for you. But I don't know if that answered your question, but those are the key. Yeah.
The others don't matter.
Well, they're not. Like I say, they're not essential for our health. They can be benign, but.
We have a couple questions back here. I'm going to pass the microphone around so everyone can hear all the questions.
Yeah, good idea.
How much would anti-inflammatory medications like Zyrtec and harden contribute to those bacteria?
Say the name of the drugs again.
Claritin, Zyrtec, those are just common allergy medicines, but they do alter your immune system, or your histamines at least. Antihistamines.
Yeah, I don't.
Do they contribute to that, or do we need not to worry about it?
I don't think they do.
Okay.
We have a question right here.
Yes. So is there a scenario where statin drugs are still considered the appropriate thing to be taken?
That's easy for me to answer. The question was on statin drugs. Is there ever a time when they should be used? I would say no. I don't think they should have been approved.
What was the question?
The question was, is there a scenario where statin drugs are indicated? My opinion is no.
I'm going to answer your question by giving an experience that I had with a patient, and they may be here tonight, but basically they're some of the nicest and most health-conscious people that I've ever met in my life, and they're not afraid to go travel to find a doctor that they really have a lot of confidence in. And they came here, and I was taking my little history, and I noticed that she was on a statin, but it was one I'd never heard of. And then I noticed, so I said, "What is this?" And she said, "Well, that's a statin." And I said, "Well, what's this one?" They go, "That's a statin." And then I said, "Well, how about this one?" They go, "That's a statin that you take by a shot." And I don't know how long it was, but so I said, "Well, you know what? But while you're here in town," they live far west Texas. I said, "While you're here," and they said, "Well, we can't stay." But I said, "Well, I'm going to call Dr. Langsjoen and ask him what we should do about these statins." And I said, and I told him, I said, "Well, here they are." And he got it. And he goes, next thing he said was, "What's their cell phone number?" And he called and had him stop all three of them right then and there. And in other words, he had me stop them, but he's obviously, Dr. Langsjoen is the go-to guy on this. You don't want a neurosurgeon telling you exactly what to do with your statin, except don't take it.
That's good. Oh, you can I got these.
I'd like to know the side effects of taking statin drugs.
You can divide them into several categories. Statins block a pathway in all cells that's essential for life. One of the compounds in that pathway is cholesterol. There's several others that get blocked. If you just look at the categories of symptoms, If you lower cholesterol, your brain is going to suffer. The brain has to have a lot of it. It has to have so much it has its own specialized cells to make it. So difficulty in concentration or difficulty with memory, it's very common. Some people, because of the myelin, which is the insulation of your nerves, will get a peripheral neuropathy. Because statins deplete you of at least 3 compounds necessary for the production of energy, one of which is Q. Fatigue is almost always present to some degree or another. There's a variable amount of muscle and or joint pain, and sometimes that can be severe. That can be, you can't get out of a chair kind of thing. So let's see, brain, nerves, fatigue, muscles. Those would be the most common, but there are many, many others. They're amazingly toxic.
Statins break down the arterial wall. Could you repeat the question, please?
The question was, do statins break down the arterial wall? I'm not so sure they do that. They do increase coronary calcification. That's now very well established, big trials. So when you get these coronary calcium scores and they say it's 200, and they put you on a statin, the next year it's going to be 1,000. You stay, it goes up. So it wasn't what they were expecting to find, but there's definitely an increase in coronary calcification.
Great, we have a question back here.
The plaque that a person might have on their teeth, is that basically the same thing as the plaque that's in the arteries?
No, but yeah, that's different.
I had the CT scan for calcium and my level was high, so my doctor put me on a statin drug. So I went this week and my bad cholesterol was 69, so I asked him about coming off, but he wanted me to stay on.
Please use the microphone.
Okay, good.
Too many people here that you can't hear any questions if you don't.
I had a CT scan for the calcium level a couple of years ago, and the level was high, so my doctor put me on lovastatin 10 milligrams a day, and I did have the joint pain and things, so he took me off for a few weeks. Then told me to start back with CoQ10. Keeps wanting to get my bad cholesterol down. Well, it's 69, so I asked him could I come off, but he said he didn't want me to have a heart attack or a stroke. So
yeah, that's kind of the party line. It's not correct, but unfortunately, there's an enormous amount of propaganda, really, that influences physicians as well as patients. I read somewhere that 50% of the cardiologists in Mayo Clinic take statins themselves. So they obviously believe it. Yeah, it's a difficult thing. It's very frustrating. Yeah.
Blood pressure. Every time you go to a doctor or something, if your blood pressure's up a little bit, they want to put you on some kind of blood pressure medicine.
Right.
I always refuse it. So, in mine, it's kind of a roller coaster at times. What you're reading this, it's not a panic.
No. Okay, here's a scoop on hypertension. In the 1970s, you had to have a reading of 160 over 100 or higher on 3 separate days before you would consider prescribing a drug. That went down to 140 over 90, and now it's even lower. I don't know what it is now, but there is such a thing as hypertension. It's just they've defined it in such a way to expand their market. But the way I approach hypertension is very simple. Number one, you need to know whether it exists or not. So office readings are sometimes falsely high. Most home blood pressure machines are good, and you can certainly check them. If you have people check their home pressures with a machine that you've checked out, and it is high, let's say it's 180 over 120 or something. Well, then the next thing you need to do is see if you can figure out why. Many people with hypertension, it's up for a reason, so you treat the reason and then it goes down. A common one would be sleep apnea. Sleep apnea definitely causes hypertension. As we get older and your Q level drops, your heart frequently becomes a little stiff. we call it diastolic dysfunction. Your body reacts to that by increasing adrenaline, which makes the heart work better, but it raises your pressure. So if you treat the heart with CoQ10, which is super easy, that goes to normal over a few months and the pressures come down. You have to look at things like stress, chronic pain, and then sometimes you can't figure it out. It's up and you have no clue why. You can check renal arteries by ultrasound. Sometimes if they're tight, it causes pressure to be high. But, so that's the first thing. You have to be diligent in trying to be sure there isn't some cause that should be addressed. In other words, don't just treat it as like essential hypertension, like it's a separate entity. Yeah.
Should I? I was put on statins, kind of the same drill with us, probably 80–90% of the room has followed heart CT, showed a little calcified, you know, some whatever they were. I'm in my 40s or so at that point. Put on statin, had some joint pain, but more importantly, had a dramatic memory problem on that statin. Took myself off and went on my business. Ran across a kind of a country gentleman down the road a little ways, and he recommended red yeast rice. They had great luck with it. I started taking red yeast rice. I had great luck with it. No side effects, no problems with that. I have a cousin whose wife works at Mayo, is the editor of their technical in-house magazine. She visited, I mentioned that to them. When we visited, they had no knowledge of it. She took that information back to Mayo. We were talking about Mayo. I thought I'd pass it along. Several doctors in Mayo internally, I found out from her, were actually taking red yeast rice. But there wasn't any official study in this medical world about that, so I was curious.
Yeah, no, I'm glad you brought that up. Red yeast rice has two statins in it. One is identical to Mevacor, and so Merck, back in the 90s, called up their pals at the FDA and said, you got to get red yeast rice off the market. And they tried to, but it's everywhere. So it's still on the market, of course. It goes back at least 5,000 years in China. They make this mush with rice and some type of grass, and the red yeast rice fungus is everywhere. So they end up with this red paste. And I guess this must be in regions where they didn't have a lot of salt, but they use it to try to preserve fish. You were lucky with the red yeast rice because a third of the red yeast rice on the market has citrinin. Citrinin was the first statin ever discovered. It was so toxic it killed every single laboratory animal. And even the drug company thought that was a little too much. And so it never was, pursued further. But the red yeast rice, about a third of it has citrinin. That's an irreversible inhibitor of HMG-CoA reductase. It can be exceedingly dangerous. I consider it the only really, truly, truly dangerous thing that's over the counter. The variability of the amount of statin and whether it has one or both is all over the place. So, you could get lucky or you could get real unlucky.
How do you diplomatically broach the subject of discontinuing statins with your internal medicine doctor?
I do my best, but here's the truth of it. Let's see a patient, and it's clear they're having significant adverse effects from a statin. And I put that in my dictation, and the basic gist of it is I think the theoretical benefit is minuscule and the harm is great. And I send a copy of that to the primary care physician. And one response is they fire their patient. That's not uncommon.
It happened to me.
It's a little bit crazy. That usually doesn't happen with other drugs. Let's say they're on a blood pressure drug and I change it or something. They're happy to, for that advice. But statins, yeah, that's a tricky thing. There's, I don't know if this applies in East Texas at all, but it's a true story. It's a friend of ours that was moving. She was a family practice, moving from Hawaii to Portland. And she was looking at this multi-specialty group, and it looked great facilities, great people. And at the end of the interview process, they sit her down in a room and they say, well, this is how it works here. If at the end of your first year, you have 50% or more of your patients on statins, you get a $60,000 bonus. If it's less than that, you're going to be asked to leave. And the way they do this legally, from what I've heard, is the drug companies can couch that in terms of a grant to the clinic for being excellent at, say, preventative medicine. So it's if things like that are going around, then you can see why they would fire you, because they can't let their number get, yeah, that's, like I say, I absolutely believe that happened in this clinic in Portland. I don't know how common that is. But. Yeah.
You don't try to talk loud, since I don't know that. You made a comment earlier about if you were lucky enough to have 300 or above cholesterol. Mm-hmm. What do you consider too high of cholesterol? And in that number, what about the bad cholesterol that we really hear about?
Okay. First, I'll just answer the first part. Fortunately, it's a very rare disease. There's a homozygous trait where our cells have on their surface receptors for these lipoproteins. And they make more of them on their surface, so they need more of whatever the lipoproteins are carrying. And it attaches there and then it's taken into the cell. So it's not just cholesterol, it's other essential things like vitamin E or Q is carried in the same little sphere. There are children born with a severe abnormality of these receptors. They either don't exist or they don't work. So cholesterol cannot get into the cell, which is a terrible problem. It's everywhere else, and they have levels of 1,000 or more. I've only seen one case in 32 years, they're rare. These children have two problems. About half of them have, in addition to the high cholesterol, that receptor problem, they have a propensity to form clots. And so many of them are having strokes and heart attacks at a very young age. If they don't have that trait, and they're 20 or 30 years old and their cholesterol's 1,000, they don't have it. And now they'll get cholesterol deposits in tendons and in skin and around the eyes. It just has nowhere to go. But that's a potentially tragic disease, but it's very, very rare. 1 in a million or less. But in the other standard cholesterol ranges, it's not uncommon to have patients in the 300s, occasionally 400. You don't normally see the thousands except with that disease.
And the bad LDL?
Oh, yeah, they just made that up. No, honestly, here's what happened. Back in the 50s and 60s, the big thing was cholesterol is causing all this heart disease. Well, once the laboratory analysis of cholesterol got geared up and people were checking it, one of the first things they did, they started checking cholesterol levels in people who'd come into the hospital with a heart attack. Turns out they are significantly lower in cholesterol than people of the same age and sex who don't have heart attacks. Well, that wasn't good news for the cholesterol theory. So they said, it's not the total cholesterol, it's the good and the bad. That's where that came from. It's ridiculous. They're both essential. No, no, don't worry about it.
So, I'm sorry, why does our cholesterol increase as we age?
Ooh, if you're talking like from infancy up, it does. It's pretty low when we're young.
Well, even in the last 10 years.
10 years, how much has it gone up?
I was always under 200, and it's now creeping close to that 300 total. My good cholesterol, well, is good. Really good.
You're fortunate. Well, I wish mine was that high. No, it's there's a lot we don't understand. We absolutely know that cholesterol goes up with stress because we make stress hormones with cholesterol. So it's not uncommon to see someone with cholesterol of 200 go to 300 in settings of stress, and then it comes down. There's also a considerable lab error. Those automated, cheapy cholesterol tests are not that. So there's probably a 15-20% swing, but I don't think it consistently goes up with age in everybody. If it does, I'm wrong about it.
Are you suggesting we shouldn't worry about the cholesterol levels?
You should worry if it's low, but unfortunately you cannot get it up if it's low. It's not possible.
Don't sweat the level.
If it's checked once in your life, that's enough. Well, it is. It's not going to change fundamentally.
No question. I'm taking the Restore under good advice, and my brother's taking it as well, and I've got several other people to start taking it. And they also make a nasal spray that has those minerals in it. And I'm just wondering if you've gotten any feedback, since we're in allergy season, if anybody is finding relief from that.
I haven't had experience with it yet. I think it's a cool idea. But
Can I take that one?
yeah, sure.
I can take this one because I think I'm the one that told Dr. Langsjoen about Restore.
Yeah.
So,
It's all your fault.
right, it's a privilege. The nasal spray is exactly the same chemical. It's the same thing as comes. What comes in the spray is the same thing that comes in the big bottle. So it's not some secret formula that's different. But I use it because I had forever, and I think part of it was when I was taking high blood pressure medicine. Some high blood pressure medicines gives you that a lot of congestion and clearing your throat and that kind of thing. But I started on the Restored nasal spray. You take it 1 teaspoon 3 times a day, just the big bottle, and then I spray every time I take it orally. I get my little spray thing and I put 6 squeezes of spray on each side of my nose, and I've virtually cured myself completely of having to clear my throat. It was a habit, and it used to drive my wife crazy, and it drove me crazy too. And I did some work on TV shows, and I'd get a little bit nervous on top of that, and then I'd have trouble delivering. But the spray goes into the cribriform plate where the nerves from the brain come down to your nose where you smell. And it'll go straight up into your brain, which is where it really needs to be. You can get higher doses in the brain of Restore than you can get it from taking it orally.
Oh, that's cool. Oh, I didn't know that. It's right up there.
So, I have a bit of a sweet tooth, and I'm curious about the role of sugar in heart issues, and is there an amount of sugar that's okay to eat without any issues, or different types of sugar stay away from?
Yeah, bugs like sugar. I'm sure on the high end of the sugar intake, it's bad for everybody. Again, if you sort of look how we've developed, We can handle small amounts of sugars, it's fine. Ripe fruits, has plenty of sugar in it. But the occasional honey. But I think that where people get into trouble with sugars is probably the habitual drinking of these really big, soft drinks. That's just like, that messes up most people. But smaller amounts, I don't think.
What does it do to the arteries or anything kind of along those lines? Is it
I don't.
Depends what is sugar to the arteries.
Yeah, I know. I'm not sure. There's these products called glycation, end products or what have you. So if the sugar is chronically high, it binds with proteins, and in fact the hemoglobin A1C that they measure is a glycation protein bond. And, there's a theory that those are not helpful. There's just a lot we don't know, though. If you get into like full-blown diabetes, it's more complicated because then you can have electrolyte, you can have all kinds of things that sort of confuse the picture. But I don't really know the answer to your question on the modest amounts of sugar. I assume they can't be too bad. We'd probably all be dead.
Okay. I know what the Bredesen Protocol is, and I'm not sure everybody in this room does know about it, but just briefly, it's a protocol for reversing Alzheimer's disease. Okay? Are you familiar with that?
I've heard.
Yeah. Well, it actually works. We've had a lot of, I bet there's some patients in here that are on the Bredesen Protocol or thinking about it. We had a group just about the same size last week that was talking about the Bredesen Protocol, and by the way, the statins and the protein pump inhibitors are two of they call them dementogenic drugs, and they will take you off of those so quick. That's why I had Peter call the people on the phone and tell them to stop it, was because that's how serious it is from a cognitive function.
Right.
And the diet that is the one that the protocol uses is a very, very low sugar diet. It's a ketogenic diet, which basically a ketogenic diet converts fat into the major thing that you use to metabolize. So it's that. So speaking about it I'm talking about cognitive function and reversing it. And so if you want to reverse cognitive function, you kind of got to get mean about it. And saying, oh well, sugar doesn't hurt me, I'll just have two donuts every other day or something like that. You'll never reverse cognitive decline with a kind of what you call kind of a casual attitude about it. So that's my take on it.
Cool.
Can I ask one more question?
Sure.
Okay, can you explain how triglycerides fit in with the cholesterol stuff?
Yeah, they're kind of cool. What's nice about triglycerides is they actually do vary with your diet. If they get really high, like 3,000, 4,000, 5,000, your plasma is like heavy cream, you can get pancreatitis, it's bad. If it's up a little bit, let's say it's 200, 300 or something, triglycerides are very, very sensitive to dietary changes. They go up with sugar and carb intake, not fat. And so, let's say someone is drinking 6 big gulps of Coke a day, their triglycerides are going to be high. They're going to be 600 or something. If they stop that, they'll drop like a rock. So whereas cholesterol, it's too important for us. And these studies have been done. You can eat 12 egg yolks every single day, measure your fasting cholesterol before and after, it's the same. Your body doesn't waste any energy making something if there's plenty in your diet. You can take those same people and switch them over to carrot sticks it's not going to come down. They make more. So cholesterol is super tightly regulated, but triglycerides are not. That's very much dietary.
So they don't have anything to do with like if the cholesterol is large or small?
No, that's a different thing. Yeah.
That's what I was willing to explain. I didn't understand that.
No. Yeah, the small particles getting through the wall and the big fluffy marshmallows, that's baloney.
It's not related to
Some more, okay.
I'd like to share with you a personal experience about statins. Several years ago, as a result of a routine blood test, my doctor said my cholesterol was high and he wanted to be on a statin. And so I began a statin drug and consequently felt very tired and very fatigued subsequent to the drug, and it didn't get any better. I talked to my doctor about it and he said, well, your body is getting used to it. It'll lighten up and you'll feel better in time. Well, it was about that time that I began thinking about food being thy medicine. And fortunately, I ran into your own nutritionist here that was working elsewhere at the time. And she helped me think about the whole notion how diet could affect us. And so I got on a totally different diet. And my numbers came down, the cholesterol numbers. And I told the doctor, look, my numbers at the next blood test result, I said to him, my numbers are down. I said, should I stay on this cholesterol? He said, yes, you need to stay on it because they'll shoot right back up if you don't. And so at that point, I just told myself I would cut them out, and I just stopped taking them. And I informed him about it several weeks later. He was not happy, but my numbers are still low, and I'm feeling great.
That's good.
There is something to the fact that cholesterols have a big downside to them.
Well, when you change your diet in some fundamental ways, a lot of things can change, including your mood and your sense of well-being, and so there are occasions when cholesterol will change, when people change things in their life. I have a funny story for you too. A patient of mine from way west Texas, he was a new patient, and he was only on one prescription drug, and he put it on the table, and you couldn't read the label. It was so worn. You could kind of make it out, and it was Lipitor. And I said, what's the story on this? And he said, well, I know this is bad, but this is what I do. In his little town, there's only one doctor. And that doctor has been helpful over the years for different things. Well, the doctor said, you need this cholesterol pill. And he says, okay, I'll take it. And, well, he couldn't even get on his horse, or his tractor, or anything. And he came back and he told his doctor, and he got that response, well, would you rather die of a heart attack or not be able to get on your horse? Well, that took him about a millisecond to decide, so he stopped taking them. But what he did was really clever. I thought it was sheer genius. He sees his doctor every 6 months just to check it out. He takes his Lipitor for about 4 or 5 days before he has his blood drawn. The doctor's happy, his cholesterol's low. And then he stops with it, of course. That's not long enough for him to feel bad. And he's been on this same bottle for like several years. And that's why it looked like it was. Anyway, I thought that was hilarious.
So he gets the $60,000.
Except the doctor will say, but I have this patient that is doing this when he actually isn't doing it. And the doctor will be telling other patients, he does fine for that. So,
Yeah, anyway.
it's giving out information that's incorrect.
Yeah.
We'll get right back to this. Relating to testing to check if your arteries are clogged, and they recommend roughly 50 and above start the colonoscopy to check your colon.
Right.
Is there a test that you suggest that we start to see how clogged our arteries are? I mean, people are having strokes and heart attacks all the time, and their arteries are clogged, but how do you know if if it's the silent killer, so to speak?
Yeah, it's a good question. I don't think we have a good answer to the radiation with the coronary CT scans. Sort of turns me off on that. Plus, calcified areas are not necessarily ever going to get narrowed, and you can get plenty of blockages with no calcium in them. So, the calcium scan I don't think is useful. The way I look at it is more practical. If someone is at least reasonably active, in other words, it's different if you've got some crippling disease where you can't do anything. But if you're up and around, your body will tell you something isn't right. You know, if you've got a narrowing of any significance, say to your heart, when you're not going to be able to do what you were doing before without having to stop or rest, or you get short of breath, or you may or may not have discomfort. But so paying attention to how you feel and how your activity tolerance is really powerful, actually. It's probably better than any test. There's things like stress tests, and you've probably all heard this story, and it happened to me, it's true. You come in, you see your doctor, and you get a stress test, and it's all fine, and you go home, you have a heart attack, and you die. That actually happened to me. There isn't anything that comes to mind. So I go by how people feel. Now, if you have symptoms that are worrisome, then other things can be done. Or if you hear a bruise on your carotid, you can easily get an ultrasound on it. But I am not sure. I don't have anything I do other than, unless there's some reason to do it.
My father-in-law, we thought, when he was an airline pilot, so he had to keep his health up. And at 78, out mowing the yard, and came in for a drink and poof, had a stroke. And we thought he was healthy.
Those guys they get a lot of radiation. That's hard on them. Yeah, they do. Yeah.
Since there seems to be, in America, there seems to be an epidemic of pre-diabetes and diabetes, especially in people over 40 and 50.
Yeah.
In your practice, do you have to treat people who are diabetic and pre-diabetic differently than people who are non-diabetic at all?
No, not. I think the healing's a big deal, and I think they for sure need to be on plenty of vitamin C. The epidemic of obesity is absolutely related to our diet. The food pyramid should be flipped around. This idea that you eat all these grains and a little tiny bit of fat on top. So we've been getting bad advice for a long time. But,
what is the effect of alcohol, moderate wine, or anything?
It's good for you. It's very good for you.
Great.
Ask your friends, yeah. No.
You're my kind of doctor.
Yep.
Could you explain the use and purpose of Cipripil? The
Cinepril?
Cipripil.
Okay, that's an ACE inhibitor. That's one of many drugs in a family that they can be wonderfully useful for hypertension. They tend to be inexpensive. They usually work. Maybe 10-15% of people will develop like a allergic dry cough. It's not a permanent thing. You stop it and it goes away. That's its most common side effect. I find that drug to be useful on average, if you have to try something.
Just so I have this straight, you're saying that statins are they're really not very good for your body and your overall health, and that doctors who are recommending that you take statins, I know my internist recommended that for me, and I might be slightly overweight, like maybe 8 pounds, but I try to eat healthy, and I exercise every day, and I don't have high stress levels. But my question is, both my internist and I know my husband's cardiologist said that it's an effective way to treat cholesterol, and that if you don't take statins, the consequences are dire, such as you have a stroke or you have a heart attack and you die. So I just want to be perfectly clear that you're saying that we need to question that.
Absolutely, it's not true. Yeah.
Absolutely, and I know I've heard it, but it's hard to wrap my brain around what I've heard for so many years. And when the doctor tells you you're going to have a stroke, you're going to have a stroke and die, and have a heart attack and die, you pay attention to what they say.
Yeah, no, it's a powerful tool, you know, that kind of language.
So I'm just wanting to make sure I'm clear on that.
Yeah, that's absolutely clear. One thing you might look into, there's a organization called THINCS, THINCS.org. THINCS.org. THINCS. It stands for the International Network of Cholesterol Skeptics. You might guess I'm a founding member, but there's, Ollie, how many people in that now? 100. Yeah, these are scientists and physicians from around the world that are really, really, really great, and they publish, and they they just never let up. If you actually look at the data on all these huge trials, statins have no benefit to them. Most of them increase mortality. I mean, it's a disaster. A patient of mine from Dallas just not that long ago, wonderful guy, just a hard-working, his mistake, he went to see the doctor. His doctor checked his cholesterol. And no, he didn't. He checked his coronary scan. And he said, gosh, that means you have to take this statin. So he does. He gets it rechecked in a year, and it's doubled. And he said, what's this? It should be better, right? He said, well, it just means you're not taking enough. So he went from 40 to 80 milligrams a day, Lipitor, big dose. Had it done a third time, it doubled again. So now he's up in the placoderm territory. That's 2,000. And then he searched the literature. He came across one of our recent papers where we point this out. And he was a perfect example of what happens. You take a statin and you accelerate that whole process like crazy. No, they're just bad. It's probably going to take a generation or two before most physicians kind of reset their thinking on it.
So there is a lot of published research, or it's just media? There's a lot of literature out
Oh, a ton of it. Unbelievable amount, actually. What they do is, like just recently, they do this all the time. There's more and more evidence that statins affect your brain. There's not any question about it. So they have this, usually these things come out of Harvard or Mayo or some big place. All these hotshots will get together and they do what they call a meta-analysis of the data. They leave out all the negative studies and they put in this other garbage. And this just came out recently. They concluded that statins, not only do they never hurt your memory, they improve it by 20% or something like that. I mean, it's complete fraud, and they do it with everything. When it was being shown that people on statins have an increased risk of cancer, which you do. Within a month, they come out with a big study saying that statins help cancer, and they should be used to treat cancer. So they do it. It's just ridiculous. If you think political propaganda is bad, you ought to read medical literature. It's worse. It's worse.
So just I don't know that everybody heard, but what you were saying is it's THINCS?
Yeah, that's it.
.com.
.org.
.org. Okay.
Yeah.
And that basically would be something where you could go pull something out and take it to your doctor and say, help me understand.
Yeah, you could. He'll probably fire you, but.
You know, I think it's kind of hard for some of us who are not trained in medicine, don't have a medical degree, because right now it seems like functional medicine is going this way and allopathic medicine is going this way. And some of us are like caught in the middle because we talk to both of them and we hear both of them, and the answers we get from both of them are not always the same from the same data.
Yeah, you almost have to, as a rule of thumb, none of these things are that complicated, even though the terminology can be. If something doesn't make sense to you, you should question it.
Yeah, but if neither one of them makes sense, or if both of them,
then you flip a coin.
or if both of them make sense.
I made all decisions in my life that way. So. Yeah, you're right, it's hard.
Well, it'll take a few years for it to settle out, possibly.
Yeah, I would think, you know, most things.
I just read a report this week about the alcohol now being bad for you, one drink a week or something. I mean, they published, you know, where 7 drinks a week or something like that would be okay, or, you know, that used to be the general thinking. Now they're saying, oh, no. New results out. So we're all over here going, I need a drink. Like, what do you believe? I mean,
yeah.
Do we have any other questions?
Yeah.
Your thoughts on stents, and do we need them if they tell you you need a stent?
Okay, that's a good one. It's easy to answer. The question is, what's my thought on stents? Do you need them and that kind of thing? The way to look at stents and bypass surgery, both, neither of them will prolong your life. Neither of them prevent heart attacks. Those are facts. Both of them are wonderful at relieving bad symptoms. So let's say you can't do anything without, you know, an elephant standing on your chest and you're taking 20 nitroglycerins a day, and you got a tight artery that they open with a stent, you're going to feel dramatically better. So they have a role in symptom relief. That's key. That's the way to look at it. And they work for that.
I'm looking here at vitamin D3 effects. Had a case where my mother was given high doses of vitamin D3 in a nursing home, and they kept missing her appointments with her neurologist. She developed hypercalcemia.
Yeah.
And it kills her.
We always check calcium with D. But, yeah.
How often would you, a person who's just taking it over the counter, want to have it checked?
You should probably, well, insurance for some brilliant reason only pays for it once a year, but you can get it checked more than that. It's not that
I'd like to
expensive.
repeat the question just so.
Oh, yeah,
go back from here. It was, if you're taking supplements for vitamin D3, how often do you need to have your calcium checked?
Yeah, well, we check calcium every time we check D. And it's, the highest I've seen was 100, which is a high range of, you know, it's from 30 to 100 is the range. But you're right, if you're on 5,000 at D3, it's not ever going to raise your calcium. But 10 maybe, but if you're in 15 or 20,000 units, yeah, you have to be careful for sure. So it just has to be checked. Or if you change it, you know, it should be checked sooner. Yeah.
I have a question. It's nice to be today. I want to address the issue that you brought up about how do you do this. I've got this doctor, I've got that doctor, and a simple way to look at it is this. First of all, I've spent 42 years being a regular doctor, but I was a surgeon, and so I didn't have a whole lot of people coming in and asking me how much cholesterol, worry about my cholesterol. But the practical matter is, the statistics are that we live in the most unhealthy country that there is on the planet. And we are 5% of the world population, and we consume 80+% of all the pharmaceuticals that are consumed on the planet. And so, and everything, our cancer rate is, nothing about our health is getting better. Everybody knows about the kids with, what is it?
Autism.
Autism.
Yeah.
It's down now to about, 5 years ago it's like 1 out of every 400, and now it's more like 1 out of every 40. And it's getting worse. Everything's getting worse. The number of diabetes is getting worse, cancer is getting worse, obesity is getting worse. You can't come up with any argument for going to a healthcare system that doesn't have any more accountability than that. And that's why I quit my surgery job. I actually decided to quit. I love surgery, but I love this a lot more. And the reason why is because I know what to do to help people get well. So don't be confused. If your doctor doesn't agree, medical doctors have the highest suicide rate of any profession in the United States. More kill themselves than ever before. Why is that? Why is it? Because they're burned out. Because they hate their lives. They've got nothing to live for. Really, I'm not making that up. They're depressed, they're on drugs, and I've got lots of friends that they know that they're trying to figure out what to do. Everybody wants to make a difference, and doctors went into it to help people. But you don't go into a doctor that's going to get $60,000 for his clinic if he puts you on a drug that has no medical benefit. So that's the way you decide what you're going to do, is look at how you feel when you go. If you talk about diet, if you talk about exercise, if you talk about stress reduction, all those things are medicine. All of those things, and only about 1% of people in the United States are actually what you call healthy. That, in terms of, I'm not talking about super healthy, but if you look at Loma Linda, where they have all these Seventh-day Adventists, and they're one of the blue zones, the incidence of chronic diseases in them and deaths from them is like a 1%. 1% of the Loma Linda people will get Alzheimer's, and it's 60, 70, 80% depending upon age. So I hope I'm not sounding shrill about it, but these are things that you're going to have to get some help. And if you can't figure it out by yourself, then what you do is you can come to look at all the people that are here trying to figure it out. That's what's so cool about it, because there are answers, and the answers that functional medicine has, or integrative medicine, is really pretty much the same thing. But we go back to old-fashioned medicine, which is looking for the cause of it. The cause of the medicine, not what symptoms you're going to get Okay, I'm I better shut up.
We have a couple of
That was great.
This is a comment along the lines of making food your medicine. 2 months ago, in the AARP news flyer, there was a short article about a chef in one of the high-end restaurants in Dallas. And he said that the primary goal, the primary function of a good chef was to make food tasty, not necessarily healthy. And I thought that was an interesting comment. And I noticed restaurants are doing that all the time, and people are flocking to them, and they don't know the oils, the ingredients, the salt that is going into all of this, and the cumulative effect of all of that is what was referred to: the diabetes, the obesity, and many related illnesses.
Yeah.
So I think there's a lot to consider, and I think where we eat and what we eat is important.
Oh, sure.
Lauren?
Yes.
Oh.
Okay, we're gonna go right.
If someone has a carotid endarterectomy and 3 months later they are told that they have a 50% blockage again, what would your thoughts be about that?
I would do everything I could to. I would do everything I could to look at every variable going on in that patient and see what you could possibly change. You just do the best you can, you know. There's a whole lot we don't know about everything, but yeah, those things happen.
Okay, do you recommend the coenzyme thing for people who don't have heart disease?
I actually
Should
do.
we all take that again? I do, but
I think it's a good idea. You need to get a good brand. Cut it open and be sure it's not black or brown or orange.
okay.
If it is, it's Chinese. It should be off-white.
Because it's
For ubiquinone, yeah.
It's from the okay, thank you.
Yep.
That's to be restored, and I love it. All illness begins in the gut, correct?
I don't know.
Okay. Well, I think I saw that somewhere, and all benefits of taking Restore along with high energy, which I think my neighbor could probably attribute to the fact that I have a lot of energy. So, it's the Restore. What correlation are you going to be doing some type of a follow-up study with your patients who are on Restore in terms of relativity to heart issues?
Oh yeah, we're watching them like hawks. Yeah.
Thank you.
We've got time for just a couple more questions. Any more questions here?
Do you believe the statement that the human body is designed to heal itself?
Yes. Yeah, definitely is. It's really good at it. Kids are better at it than we are.
All right, we've got one more question to go with that.
Okay, I have one more time, so. How do you find an integrative physician for your primary care?
How do you find one?
Yeah.
Oh, maybe Guy might be able to answer that.
Yeah, first of all, in integrative or functional medicine, we use those terms interchangeably, and we do not replace a primary care doctor. You need all kinds of things that, like who's going to get your colonoscopy or who's going to do your lab and things like that. And acute illnesses, but for what we do is take care of chronic disease in people that really are so sick that they can't get well on their own. And it's true, we start thinking first about what we eat. And if you think about it, doctors, physicians in medical school, we get maybe one day of lectures about nutrition. If you go to vet school, you get all kinds of lectures about it, and that's why when you take your dog in and you set him down there, first question he asks you is, what are you feeding this little fella? But that's because they know how important it is. And just for example, I had a patient that I sent to a gastroenterologist doctor, smart guy, I really like him, he's really good. He did a colonoscopy on the patient, and he got a biopsy of some tissue that was kind of funny. He didn't know what it was, but the pathologist came back and said, you've got Sproul disease, which is a kind of an inflammatory disease in the bowel. And so my patient said, well, oh my God, what do you do about it? And he said, well, you have to go on a special diet. And she said, well, what diet is it that I go on? He goes, how would I know? You can Google it. I'm not kidding. You can't make that up.
Are there any other questions before we wrap up tonight? We've got one more question. Last of the night. Here we go.
My question is about acute medicine and integrated medicine. Obviously, I've been studying some of them, and say there seems to be starting to be a shift from for MDs coming into integrative medicine out of acute medicine. But there hasn't been a shift, as far as I can tell, of the money coming, like from insurance companies or payments or anything like that, coming out of acute medicine. They'll pay for acute medicine, they won't pay, in most cases, they'll pay for integrative medicine.
Right.
So
Follow the money.
follow the money. You see more physicians moving over into functional medicine.
I don't know what the numbers there would be. I'm not sure.
The answer is there's every year there are more and more MDs that go into functional medicine, go through the process. And at the meetings that when I started going a couple of years ago, the average size of the class, and there's lots of classes, and it's very grueling to do, I promise you that. But there used to be about 400 or 500 people at one of these courses, and now there's way over 2,000 in each one. And the number of people that are getting all the way through and getting credentialed, it's going up, it's going up, it's going up. And there's lots of nurse practitioners and PAs, and there's the nurses and the nurse practitioners, they are in the same double bind going and working for a clinic, because they still have to see a patient every 10 minutes, and they have to do all the records and write prescriptions. The doctors write prescriptions because they don't have anything else to do. I mean, there's nothing, you can't tell anybody anything about what's really wrong with them in 10 minutes.
Right.
But the answer, and the other thing is that with Obamacare, the healthcare system that is dependent upon the insurance companies, and the insurance companies support big business. That's why they won't let you come in. But that is really changing, and there's a lot of different kinds of insurance plans that are coming up, and they're coming on. And there's one is the savings accounts that you can put your own money in your account, write a check for it. You can get your
Health savings accounts are great, and have to just get Congress to let you do that.
Yeah, well,
Everyone going along, when you turn 40 and you have some physical issues, there's some money there to deal with.
well, there is a point in time when the tables turn. There's been, they call it a paradigm. And a paradigm is when everybody does it this way, and then it kind of levels off, and then it starts going down, and then there's another one that comes up and crosses it over. And we're not that many people from having the tipping point. It'll probably be in the next 5 years. And there's a lot of insurance companies that they go by different names. They're kind of like co-ops, and they're not called insurance, but you can get those here in town.
Cool.
Thank you for all these. Thank you all for being here, and thank you for all these.
Yeah.
Thank you so much.
Oh, you're welcome. I enjoyed it.